Hi, I'm Dr. Robert Moore, and I want to talk with you today about how being overweight can affect diabetes and your blood sugar. I get a lot of calls from people saying, my doc is worried about my blood sugar, my A1C is going up, I'm close to being pre-diabetic, or I am diabetic and I'm taking a bunch of medication. I don't like it. My mom was diabetic, my uncle was diabetic, I saw them lose their feet, I saw them lose their mind and have a heart attack. I don't want to be that person. I'm on my way, my doctor's worried about it. How can losing weight help me? First, let's talk about how losing weight affects you negatively, then we'll talk about how it can help you. Normally, when you eat food, your blood glucose level goes up. And your pancreas and your nervous system recognizes this. Your pancreas then puts out insulin into your blood. Insulin goes to the cell. There's little receptors on the cell. That allows the gateway in your body cell to open up and blood sugar gets into the cell. That's what happens normally. When we're overweight, those fat cells, they make a whole bunch of what are called inflammatory cytokines. And what those are is a variety of nasty chemicals floating around your body from the top of your head to the bottom of your feet, destroying everything that's good and aggravating everything that's bad. In the case of your blood sugar regulation, what those cytokines do is they come down to the insulin receptors and they block them. They inhibit those receptors. And now insulin can't do its job. So that shuts the gate for glucose to get in the cell. What happens then? We get an uptick in glucose levels in the blood. Now, when we have a lot of glucose in the blood, we get what's called polyphagia, polyuria, polydipsia. We're hungry, we're thirsty, and we're peeing all the time. We also can get permanent nerve damage. We can damage our eyes. That's the problem with high levels of sugar in your blood. So what happens is your body, your pancreas will kick into gear and they'll try to make more insulin. So now as a result of this, we start getting more insulin production from the pancreas. Our insulin levels increase because we become resistant to the insulin. What is insulin resistance? That's called type 2 diabetes. We've got all this insulin in our system. We've got all this blood sugar in our system because these cytokines are blocking these receptors. We can't get the sugar into the blood. We've got high levels of insulin to try to compensate. We've built up a resistance to the insulin, and high levels of insulin are a problem because that inhibits fat cell breakdown. So now we can't break down the fat that we already have. High levels of insulin stimulate fat cell production. Now we're getting more fat cells, and they're getting bigger, making more cytokines, making this process even worse. Insulin degrades the mitochondria of the cell. And what does that mean? It'd be kind of like I walk outside and I take some of the charge out of the battery in your car. Only I do it a trillion times through all the batteries of the cells of your body, the mitochondrial function. Insulin increases your inability to handle reactive oxidative stress. So all those excitotoxins, all those oxidative stress things that are going, oxidative reduction reactions in our body from all the poisons and chemicals in the world and all the stress we have, we lose our ability to fight that with high levels of insulin. With high levels of insulin, it also messes up what's called our ENOS, or endothelial nitric oxide synthetase, that protects the endothelial lining of our blood vessels, which affects every single blood vessel in our body. And that does not allow us to protect our cardiovascular system, which creates more inflammation, which creates more aggravation, and just persistently does this. If we can lose the weight, if we can lose the weight safely, if we can lose the weight effectively, if we can lose the weight affordably and with some coaching and make some lifestyle changes, we can change this. We have seen people lose over 100 pounds plus on this program. Women typically lose between 20 and 30 pounds in the first 60 days. Men 20 and 40. But we've seen people lose over 100 pounds. We've seen people, diabetics, go off their medication. We've seen diabetics reduce their medication. We've seen pre-diabetics not go on medication. We've got the phone call, Dr. Moore, I'm worried. Only months later say, Dr. Moore, I'm doing great. This is awesome. This is how I want my lifestyle to be, because we're going to coach you along the way. Diabetes is one of the worst diseases I can think possible, because from the top of your head to the bottom of your feet, your body is being destroyed. That is diabetes. So if we can do something to change that, to stop you from aggravating it, to stop it from getting worse, maybe even give you a chance to reverse that effect, that would be amazing. When we lose the weight safely, effectively, affordably, and with making lifestyle changes and coaching, which is what we do, your life can change for the better. So if you or a loved one would like to know more information and talk to me personally, call our office, 810-374-0304. God bless you. Have an awesome day.